Welcome to Chapter 26, Helpful Hints, this time for congenital anomalies. Let's begin with a review of congenital anomaly. A congenital anomaly is considered an abnormal condition that is present at birth. Now, there are a few things to consider with this definition. Sometimes a person may be born with a congenital anomaly and not know it, and it may not be recognized or diagnosed until later in life. We see this sometimes with heart conditions. So it's okay if a congenital anomaly is diagnosed later in life because you can use these codes at any age. It doesn't have to be just for a newborn. These codes may be used throughout the life of the patient. When a congenital condition is diagnosed during the same admission as when the infant is born, so they're making this diagnosis during the same encounter of the actual birth, then the congenital anomaly will be assigned as a secondary diagnosis following the principal diagnosis for the live-born infant, which is a code from category Z38. We will actually talk more about this category Z38 in the next chapter when we discuss perinatal conditions. But just looking at this example, here we have a term birth, single male, vaginal delivery, incomplete cleft lip on right side. So remember, we are not coding for the maternal record anymore. Now we're coding for that newborn record. So in newborn records, our principal diagnosis will always be that live-born status. So we will start with the main term of newborn, and then there's a subterm for born in the hospital. And this leads us to code Z38.00. Then we will pull in the code for the congenital condition. In this case, we have cleft as the main term, lip as a subterm. It tells us it's on the right side. It also tells us it's incomplete. That's just telling us that it's a unilateral cleft lip, which leads us to code Q36.9. Let's code together an example from exercise 26.1. So here we have unilateral cleft lip and cleft palate, soft and hard, correction of cleft hard and soft palate via incisions on both sides of the cleft, and repositioning of the tissue and muscles. Then we have a second procedure going on here, repair of cleft upper lip open. So we have the correction procedure and the repair. Let's start with the diagnosis. So these cleft palate and cleft lip conditions, it gets a little confusing through here, so make sure you read closely when you get to the alphabetic index for these cleft, palate, and lip conditions. But we will start with the main term cleft, palate, and it's telling us it's both soft and hard. So we will go to hard with soft with cleft lip unilateral. This leads us to Q37.5. You can tell you can actually take the other subterm. You could actually go to cleft palate, soft with hard with cleft lip unilateral. We'll get the same code. Now looking at the procedures, we are actually going to end up with 3 procedure codes. The documentation tells us that the cleft palate is being corrected through repositioning of the tissue and muscles. So let's begin with the main term in our PCS code book of reposition for the repositioning. When we get to the subterm palate, you will notice that there is not a subterm for both hard and soft. They are two separate subterms. So since they are both being corrected, we need to pull in two codes because there's just not one code for both. So we will be pulling in reposition palette hard, which leads us to table 0CS2, and reposition palette soft, which leads us to 0CS, same table, this time the body value of 3. And then they both will have as the fifth character a 0 for open procedure, the clue word here being incisions in our documentation, and then ZZ to finish out those two codes. Then we need to pull in this repair of cleft upper lip open. So we will go to the main term of repair, lip, upper. Here's our fifth character for that open procedure. No device, no qualifier. 0CQ, 00CZ. Let's code one more example together, again from exercise 26.1. So here we have large congenital atrial septal defect and patent foramen ovale, or PFO. Then as our procedure, we have repair ASD PFO with insertion of synthetic prosthesis across atrial septum via cardiac catheter to reinforce atrial septum. Phew, that's a lot, but actually we only have two codes going on here. So your first instinct is probably to start up here with our diagnoses, so that's good. If you look up ASD, you start with the main term of defect, and there you find a subterm septal, atrial, Q21.1. Or if you decided to start with the PFO route, you can start with the main term patent, foramen, ovale. We have the same code, Q21.1, either route. The key here being remembering we need to do a little research. So if you are not familiar with either of these diagnoses, go out and do a little research, but I'll let you know now, both ASD and PFO, these are both considered a hole in the wall between the upper chambers of the heart. However, the causes are different. So ASD is when the tissue between the chambers fails to form. It's considered a congenital anomaly. PFOs only occur after birth, where that opening fails to close between those two upper chambers. But you can see here, it's coded to the same code, so it's all okay. They both are holes in the heart between those upper chambers. So when you get to the tabular list, because we know to always check Q21.1, when you find atrial septal defect, you see listed below the PFO also. So we know we're okay just to include this one code here. So Q21.1. As for the procedure, let's remember back when we were coding for hernia repairs a few weeks ago. We usually could code to the root operation of repair unless there was a supplemental material like mesh. Remember that? Unless mesh or some other supplemental material was used in the actual procedure, then that was our clue to use the root operation of supplement instead of repair. So the same concept comes into play here. The repair is being performed with the use of a synthetic prosthesis to reinforce or to supplement the body part. the atrial septum. So we're actually going to start with that root operation then of supplement, septum, atrial. This leads us to 0 to U table. 5 is our body part, atrial septum. We will actually pull in 3 as our 5th character for percutaneous. Now, how do we know it's percutaneous here? It's not saying percutaneous. Well, the fact that they're doing this via a cardiac catheter without any visualization, because if they had mentioned a scope or any sort of visualization, remember we would code that to percutaneous endoscopic. But via a cardiac catheter usually means they're inserting a catheter and a wire up through, actually through the groin, usually for this procedure, and threading it up all the way up into the heart to help correct this condition. So via cardiac catheter is going to be our clue here that this is a percutaneous approach. Then we will pull in our 6th character of J, synthetic substitute, because it tells us up here we have a synthetic prosthesis. And then we have no choice for character 7, no qualifier. So this leads us to 0 to U, 5, 3, J, Z. Happy coding. See you next time.